afternoon, and thank you for joining us for today's virtual media briefing about COVID-19 in London and Middlesex County. We're glad to have you along with us. Also happy to be joined this afternoon by the Mayor of London, Ed Holder, the Warden of Middlesex County, Cathy Burghardt-Jesson, the Chief Medical Officer at London Health Sciences Centre, Dr. Adam Dukelow, and the Acting Medical Officer of Health for the Middlesex-London Health Unit, Dr. Alex Summers. Happy to be joined this afternoon by the members of the media who are in attendance. And a quick reminder that if you do have questions, and we do already have several in the queue this afternoon, but if you have questions that have yet to be answered, just click on the question mark inside the text bubble here on Microsoft Teams, indicating your name as well as your media outlet and who your question is. Finally, a welcome this afternoon to those of you who are joining us on Rogers Television, as well as the Rogers Facebook page or YouTube channel, listeners on Global News Radio, 980 CFPL, and those who are watching us on the CTV London website. Let's begin with our opening remarks, and we'll start today with Mayor Ed Holder. Mayor Holder.
Well, thanks, Dan, and good afternoon, everyone. Obviously, the big news of the day is that appointments bookings open at 8 o'clock tomorrow morning for all 5 to 11-year-olds here in London and Middlesex and across Ontario. I'm sure Dr. Summers will have more details, including when specifically shots will start being administered after appointments are booked. But for my part, let me just say, if you're a parent of a young person or a family member, please, if you have any questions or concerns about this vaccine, do consult the health unit or your family doctor instead of a mem or the comments section on social media. It's just too important. We're seeing case counts slowly rise across Ontario, and the 5 to 11-year-old age group is a major reason why. Every single day, approximately some 30% of all cases in Ontario are young people, while here in London, Middlesex, the 5 to 11-year-old demographic maintains the highest infection rate per capita of any age group. And that's not good. The reason for these numbers, of course, is simple, though. Until now, nobody under the age of 12 could get vaccinated. That all changes this week, and with colder weather setting in and more activities moving indoors, the chance to get tens of thousands of young people protected against the virus, well, that couldn't come at a better time. Not only does it protect them against the virus, it reduces the likelihood of severe illness, along with the risk of spread to more vulnerable populations. That's why it's so important. You know, as this vaccination campaign for young people ramps up, you're sure to hear all kinds of fear-mongering and deliberate misinformation. You'll hear about overstated risks, which are completely absent of context and truth. You hear much of the same nonsense from anti-vaxxers that has repeatedly been proven false. Don't believe it. At the risk of repeating myself, please get your facts from the experts. Hesitancy and some level of concern from parents is to be expected, but I guarantee you'll feel much better if you take those questions to medical experts instead of internet trolls. You'll get better, more reliable and fact-based information. You'll feel more comfortable and confident with your decision as a result. As previously mentioned, London Middlesex has among the highest vax rates for 12 to 17-year-olds in all of Ontario. So let's do the same starting this week with the 5 to 11-year-old crowd and deal with what could be a decisive blow against COVID in the process. Now, as I turn it over to Warden Cathy, I just want to offer my thanks to her for all her time with us during these COVID announcements. This is going to be Cathy's last declaration. I'll let her comment on that and her last media report with us. Unless we bring her back by special news report. But more importantly, Cathy, thanks so much for what you've done on behalf of Middlesex County and what you've done for London as well by participating in this has really been significant and a difference maker. And you're one of those kinds of people. So from my heart, thank you. From the City of London, thank you for your contributions for helping us all fight the pandemic. Over to you, Cathy.
Well, I mean, thank you so much for that. Ed, I do appreciate it very much. Your kind words really do mean a lot. And it has been a privilege to be part of all of this. And as Ed said, this is my last briefing. My colleagues at Middlesex County will be electing a new warden in the coming weeks. And I have a commitment next week, so I won't be able to join you next week. So today is it. So as I was preparing for today's briefing, I reflected back on a number of statements that I have shared with you over the last 18 months or so. And for the most part, the messaging never really changed. I still laugh when I think of health officials and elected leaders encouraging everyone to wash their hands. I mean, really, at what point did that social protocol get lost? I do want to take a moment, though, to thank those that live, work, or play in Middlesex County. I have been extremely proud to represent you during this time. Our residents, our businesses, you have done such an admirable job surviving through these times. Like every other community, things have been stressful, but when you were asked to change the course, when you were asked to step up to stricter protocols, when you were asked to stay home, you did. Certainly there have been outbreaks, there have been spikes in cases, and there have been lives lost, but we have held our own in Middlesex, doing what has been asked of us. When it came time to line up for vaccinations, you did that. I had the privilege of working in the early days at the vaccination clinic in Mount Bridges. And in those days, the lineups were long and time slots were booked to capacity. Well done. Congratulations and thank you. As we learn about the process to book appointments for children 5 to 11, I encourage parents to do so. There is no question. This is a big decision and one that should not be taken lightly. But I have faith in science. And if you are at all concerned, do your research, speak with your healthcare provider, get your questions answered. I trust that you will gain the same faith I have. Vaccinating this demographic will make a huge difference in controlling the COVID numbers, and it will move us ever closer to that finish line. To all of our frontline workers, those that work in long-term care or in any healthcare facility, to our emergency workers, and of course, our paramedics, to those working in grocery stores and other settings that have been deemed essential and that were deemed essential. When we stayed home, you couldn't, and you didn't, and we will be forever grateful for that. We know it wasn't easy. You feel the stress of it each and every day, but your commitment was inspiration to all of us. As I have said many times, I remind you to look out for your mental health and well-being. These have been difficult times, and the stress is worn by all of us. Be mindful of your family, your friends, your neighbors. Look out for those that might be struggling as we all continue to deal with this pandemic. There are many community resources to help you cope. Please reach out. You do not have to work through any of this by yourself. I do want to acknowledge the team here at the Middlesex-London Health Unit. The communications crew is a great team to work with. You have done a remarkable job keeping our communities informed as to what's happening on an ongoing basis, even when it seemed like things were changing daily, if not hourly. It was appreciated by not only me, but my colleagues, the county administration, and I dare say our residents, that you included the warden in these briefings. Well, I don't know how much wisdom I imparted. I know that in concerning times, I look to my leaders for comfort, calm, and continuity. And I do hope that in some small way, I was able to offer that. So with that, I will hand it over to Dr. Summers, but not before reminding all of you one last time, if you have COVID symptoms, get tested. Stay home if you feel ill, wear a mask. Support local. If you haven't already, please get vaccinated, and I encourage you to vaccinate your children. Be kind, be patient, but most of all, wash your hands.
Thank you, Mayor Holder, Warden Cathy, and to Warden Cathy, your leadership through the last 18 months, your support of the entire team here at the Middlesex-London Health Unit, and of all the residents in the county, and as the Mayor noted, in the City of London as well, is noted, valued, and appreciated, and applauded. We will certainly miss you here, but know that your ongoing leadership continues regardless of the title. Thanks to you for everything you have done. As outlined in MLHU's media briefing and media release this morning, children 5 to 11 years of age will be able to book appointments to receive the COVID-19 vaccine at MLHU's mass vaccination clinics starting tomorrow, Tuesday, November 23rd at 8 a.m. For clarification, kids who are turning 5 in 2021 are also able to book an appointment starting tomorrow morning. Over 28,000 appointments over the next 4 weeks will be available starting tomorrow to kids in this age group. In addition to those appointments at the mass vaccination clinics, vaccines will also be available shortly in participating pharmacies and primary care offices. There are so many places to go and get vaccinated. We're anticipating the arrival of the pediatric formulation of the COVID-19 vaccine midweek, and the first vaccines will and should be administered starting this Friday, a short 7 days after the approval from Health Canada. This is tremendous news, and there are so many reasons for kids 5 to 11 to get vaccinated. The vaccine is effective. The studies of this Pfizer pediatric formulation shows an estimated 91% reduction in the risk of symptomatic COVID-19 for this age group as a result of the vaccine. Also, it means that even if a kid does get COVID-19 despite being vaccinated, the vaccine decreases the risk of complications from COVID-19, including long COVID-19 and hospitalization. The vaccine will help protect loved ones around kids, protecting those who can get very sick if infected, and those for whom the vaccine may not be as effective because their immune system doesn't quite respond as well. The vaccine has shown itself through its administration in adults to be remarkably safe, and the trials that were done in those 5 to 11 show the same. Severe adverse events are exceptionally rare. The vaccine also means a return to life, a return to travel, a return to social activities, a return to a lower risk of missing school, even if exposed to someone with COVID-19. In so many ways, this vaccine means that kids can be kids again. And for that, we celebrate. It is a good news day, and we look forward to those appointments going live tomorrow and those first vaccines going into arms this Friday. I mentioned on Friday the health unit is preparing for this for weeks, if not months. You will find that our mass vaccination clinics are as child and family friendly as they can be. We have our immunization hero ready to greet kids. We will have stress stars available to support and distract kids through this process, reminding us all that this is a heroic act that our kids are doing for themselves and for us. A substantial number of appointments will also be made available for individuals eligible to receive a booster dose. As a reminder, individuals who are 70 plus, healthcare workers, Indigenous individuals and non-Indigenous household members, and individuals who received a full series of a viral vector vaccine like AstraZeneca are eligible to receive a booster dose 6 months after they received their second dose. They can get that appointment at our mass vaccination clinics as well as at pharmacies and through primary care. The mass vaccination clinics at the Western Fair Agriplex and Caradoc Community Center are ramping up, and as a result, our team is growing again. If you are interested in supporting our campaign, particularly as an immunizer, please visit our website for more details on the positions that are available. The health unit is reporting 14 new cases of COVID-19 today, reminding us that indeed this pandemic is not over and the ongoing vaccination effort remains as important as ever. Case counts are rising across the province and gradually here in Middlesex-London as well. The incident rate remains highest amongst individuals who are unvaccinated, with the risk of COVID-19 remaining substantially higher amongst those individuals who are unvaccinated. Tragically and regrettably, we are reporting 2 new deaths today, as well as noting a 3rd death that was reported over the weekend. 2 of these individuals were fully vaccinated, and these deaths remind us of the severity of this illness and the ongoing vigilance required to protect our community against COVID-19. As we move indoors with the cooler weather, it is increasingly clear that for those who have not yet been vaccinated, it is only a matter of time, regrettably, until you are exposed to COVID-19. It is not a question of if, but a question of when. And unfortunately, when you are exposed to COVID-19, you will put those around you at risk, including those that are fully vaccinated. It is not too late to get vaccinated if you've not yet received your first and second dose. However, as we go into the winter, that urgency ramps up even more. If you've not yet booked your dose, please visit our website at covidvaccinelm.ca, visit a participating pharmacy, or of course, talk to your family physician or nurse practitioner. These are exciting days ahead with the approval of vaccine for 5 to 11-year-olds, and we celebrate that, mindful that we still are dealing with a tragic virus. Thanks for joining me today, and I'll pass things on to Dr. Dukelow.
Thank you, Dan, Mayor Holder, and Dr. Summers. Thank you as well to Warden Burghardt-Jesson for your service to Middlesex County. It's been a pleasure partnering with you on these briefings over the past year, so I truly appreciated it and look forward to your ongoing successes and ongoing leadership role. As of this morning, LHSC is caring for 19 COVID positive inpatients, with 10 of those in critical care. In our children's hospital, we were caring for 5 or fewer patients with COVID-19. Like our partners, we were pleased to hear Friday's announcement from Health Canada on approval of the Pfizer vaccine for 5 to 11-year-olds. We were reminded regularly of the need to protect our children from this virus, and as healthcare community, we know the fastest, most effective way out of this pandemic is through vaccination. We have been working collaboratively with our partners at Middlesex-London Health Unit. Once again, we continue to work collaboratively with them and are prepared to play our part in vaccination of this age group. We encourage parents and families to consider booking an appointment when they open tomorrow morning. I know I will be. Our rising inpatient numbers are an important reminder that we are not yet out of this pandemic. The rise is consistent with the rise in overall cases we are seeing in the province. You can make a difference by following all the public health guidelines and getting vaccinated at your first opportunity. I had the luxury yesterday, or the privilege, of getting my 3rd dose as a frontline healthcare worker. And as I was exiting the Agriplex, there were 2 individuals that were there that had just got their 1st dose, that had been eligible for some time, but realized the importance of it. I thanked them on the way out. Vaccination adds another layer of protection against COVID-19, reducing both the risk of transmission and the likeliness of severe individuals or death if infected. You can prevent unnecessary hospitalizations by protecting yourself and those around you. Thank you for taking the time to be here today, and I look forward to your questions.
Thank you very much, Dr. Dukelow, Dr. Summers, Warden Burghardt-Jesson, and Mayor Holder. We do have a number of questions in the queue, so let's get to those right away. The first comes from Christy Lee Varley at CTV London. Dr. Summers, I'm thinking this one is for you. What if a child is close to turning 12? Do they wait to get a different dose or get what they can get now?
Thanks for that question, Christy Lee. With the approval of the pediatric dose, we anticipate many questions about kids that are about to turn 12. It's really important that we don't delay in getting vaccinated. Kids have a robust immune system and will have a great immune response to either formulation when they're around the ages of 11 or 12. For kids that are 11, they will receive the pediatric dose. Once they turn 12, on their 12th birthday, they'll receive that adult dose. If a child is vaccinated with a pediatric dose because they're under 11, and then they turn 12 before they're eligible for their 2nd dose, they'll receive the adult dose as their 2nd dose. So it all depends on when your birth date is. If you're 12 and older, you get the adult dose. If you're 11 years old and 364 days old, you will receive the pediatric dose. And again, I anticipate no fundamental difference in the immune response amongst either of those situations. The important thing in all this is not to delay. Protection now is better than protection later, and either one of these vaccine doses for that age bracket will result in substantial protection. Hope that answers that question, Christy Lee. Back to you, Dan.
Thanks, Dr. Summers. Let's go to a question from Jane Sims at the London Free Press. And Dr. Summers, I think you answered the beginning of Jane's question. She was asking about the vaccination status of the people whose deaths were reported in the last few days by the health unit. But Jane would also like to know, Dr. Summers, if you can account for the recent increase in deaths locally that we've been seeing from COVID-19.
Thanks for that question, Jane. I would highlight that the 2 individuals who were fully vaccinated had also received a booster dose. However, they'd not yet had any protection from that booster dose at the time they were exposed to COVID-19. As we know, there's a 2-week window after you receive a vaccine where we would not consider you to have received any protection from that vaccine because your immune system is still ramping up, and unfortunately that was the situation here. In terms of the recent deaths in our region, deaths continue to be fairly low in number. However, we have seen a number in the last week. I don't know if there's a specific explanation for that, other than the unfortunate tragedy of this pandemic where deaths will happen, and they will sometimes happen in close timing with one another. It's a reminder that case counts are rising, and as case counts rise, the probability of hospitalizations, ICU admissions, and of course death also go up. Despite most of our population being fully vaccinated, the virus will continue to circulate, primarily driven through those that are unvaccinated, but also putting those who are fully vaccinated at risk of infection. When that can happen, the probability of a severe outcome is lowered by the vaccine, but it is not zero. And unfortunately, we see that in evidence with the reports of those deaths over the last couple of days. Thanks, Dan.
Thank you very much, Dr. Summers. Let's go to our next question, and it's a follow-up from Jane Sims. For you again, Dr. Summers, how many appointments will be available daily for kids at the mass vaccination centers? And do you know when the pharmacies will be receiving their doses and how soon they could be vaccinated?
Thanks, Jane, for that question. Our appointment capacity at our mass vaccination clinics are ramping up. As I mentioned, over the next 4 weeks, we will have 28,000 doses available through both mass vaccination clinics in our region for children. 70 to 75% of all appointments in our mass vaccination clinics are dedicated to kids under the ages of 11, the remainder to adults for first, second, or booster doses. Each and every day, once we get, for example, Western Fair Agriplex up to capacity, there'll be around 1,200 appointments available for kids, an additional 300 for adults. The CareDoc Community Center will be, when it's operating, approximately 250, 200 appointments for kids. There are lots of opportunities to get vaccinated. And as you mentioned, pharmacies as well will be getting the vaccine shortly. They'll likely see vaccine arrive around the same time we see it, although I don't have direct line of sight on that. It might be a few days later. They're getting it directly from the Ontario pharmacy, so not through us. Primary care in our region gets the vaccine directly from us, and we will start to distribute it to them as soon as Thursday or Friday this week. So very quick turnarounds. By this time next week, we should see vaccine certainly in pharmacies and primary care, and obviously in our mass vaccination sites as well.
Thank you, Dr. Summers. Yes, things are moving very, very quickly indeed. Next question. One more question from Jane Sims before we leave the London Free Press. Dr. Summers, can we get an update on third dose coverage? Will those stats appear on the online dashboard that gets updated every day?
Yeah, great question, Jane. We're working on that would be the short answer. Other health units across the province are also trying to determine how to best present this data. It's a little bit more challenging to capture from the databases than we have relative to the first and second dose full vaccination coverage. So that's an active work plan that we're working on. We've seen relatively good uptake as far as we can tell amongst those that are eligible for third doses. Certainly not as robust or as rapid as the first and second dose uptake that we saw back in the spring and the summer. We've seen great uptake in our long-term care homes and retirement homes amongst residents. Those individuals received a third dose back through the early part of the fall and into November. More to come on that. We should hopefully have some additional information for the community around booster doses in the near future.
Let's go back to a question from Christy Lee Varley at CTV London. Dr. Summers, with discussion out there about the number of young people developing myocarditis and or pericarditis, should parents be concerned about this in young kids being vaccinated?
Hi, Christy Lee. Yeah, great question. Fortunately, the risk of myocarditis and pericarditis from the initial studies that have been done appear to be lower amongst kids under the ages of 12. So the risk of myocarditis and pericarditis, just to emphasize that, appears to be lower amongst those under the age of 12. The other key variable that's being considered is the extended second dose interval. As you may have heard, and as I have not mentioned today, for kids 5 to 11 and for everybody, frankly, moving forward, the interval between your first and second dose will be highly recommended at 56 days or 8 weeks. And one of the reasons to do that is to decrease the potential risk of myocarditis. It appears that having an extended second dose interval reduces the risk of myocarditis and pericarditis. So those are other precautions that are being put in place. I will also emphasize that the risk and severity of the myocarditis and pericarditis events that have been seen following immunization are less severe and less frequent than the myocarditis seen from getting COVID-19. If you want to avoid myocarditis, the best thing to do is get vaccinated rather than take your chances with the virus itself. And as I mentioned, with the Delta variant and with us moving indoors, the question of whether you will get COVID-19 is not the question to be asked, it's a question of when. So I would reassure parents and guardians that the risk of myocarditis and pericarditis in people of all ages, but those under the ages of 12 in particular, is very, very low, likely lower than the age demographic above it, and reduced further by the extended second dose interval. And just to remember that you're actually reducing the probability that somebody is going to get myocarditis by getting vaccinated, because it reduces the risk that you're going to get COVID-19. Thanks, Dan.
Thank you. Let's go to the next question. And this is a follow-up from Christy Lee Varley. Dr. Summers, how extensively has the vaccine been studied in children that parents and guardians can trust that their kids will be safe getting it?
Thank you very much for that question, Christy Lee. The vaccine has been studied extensively in children. The pediatric formulation of the Pfizer vaccine underwent robust phase 1, phase 2, and phase 3 trials, and then was evaluated by Health Canada. Many will note that Canada was a few weeks delayed in approving the Pfizer vaccine for children relative to the United States. And to me, that's encouraging. It demonstrates that the Canadian process was independent and was ours. And we can be confident that this has been reviewed in depth by Health Canada and by the National Advisory Committee on Immunization. This vaccine went through a robust phase 1, phase 2, and phase 3 study. The same studies, in fact, that were used to evaluate the adult formulation, the same type of study where the vaccine and a placebo were given to a population of a group being studied, and the effectiveness and the side effects of those vaccines were studied. And again, what has been shown repeatedly is that this vaccine is highly effective and safe. So we can be very, very confident in the ongoing rollout of this vaccine to kids in our community.
Thank you very much. Let's go to one last question from Krista Lee here. Dr. Summers, for kids who were born in 2017, who will be turning 5 in 2022, when will they be eligible to receive the vaccine?
Yeah, great question, Christy Lee. The province actively is reviewing the plan for kids born in 2017. Obviously, kids born in 2016 will be turning 5 before December 31st of this year, which means they're either 5 or they're 4 and 11 years of age. And the difference between a 4 and 11-month-old and a 5-year-old is immaterial with regards to giving this vaccine. Come January, it's a little bit of a different story. In January, we'll have kids that'll be potentially 4 years and 1 month old, and the advisory committee at the provincial level is determining whether or not we will be moving forward in vaccinating those who are born in 2017 as opposed to turning 5 at some point next year. So more information to come. And again, that's just because the difference between somebody who's 4 years and 11 months old to a 5-year-old is minor, whereas the difference between somebody who's 4 years and 1 month old and a 5-year-old is a little bit bigger. So we just need to evaluate that a little bit more closely.
Thank you very much. Jacqueline LaBelle is joining us from Global News Radio 980 CFPL. And I know Jacqueline joined a little bit late, Dr. Summers, and I know you've touched on this, but if we could revisit it a little bit, that would be great. Dr. Summers, can you provide more information about the 3 deaths reported since Saturday? What was the status of the 3rd individual, and which 2 were the ones who were fully vaccinated?
Thanks, Jacqueline. we certainly can provide some additional information on these cases. I do want to emphasize, when we're talking about the outcomes of individuals, particularly when we're talking about deaths, we do comment on the vaccination status of those individuals. And the reason we do that is just to highlight the importance of getting vaccinated. The vaccine is not perfect, but it's darn close. And nothing, simply nothing, will reduce your risk of infection, hospitalization, ICU admission, or death as much as the vaccine. We do know that individuals who have other comorbidities or other health conditions may be more vulnerable to dying of COVID-19 even if vaccinated. However, that doesn't make these deaths any less tragic. And I want to emphasize that as we discuss the vaccination status of these individuals. Of the 3 individuals that have died in the last few days, 2 individuals were fully vaccinated. Those individuals were in their 80s and 90s. The other individual was not vaccinated. They were in their 60s. And again, we grieve with our community with the tragic passing of those individuals, acknowledging that we are now approaching 250 deaths from COVID-19 in the Middlesex and London region. It is a reminder as to why we are taking and have taken the important steps to protect our community against this virus. Thanks, Dan.
Let's go to our next question, and we're hearing from Jane Sims again at the London Free Press. Dr. Dukelow, this question is for you. Dr. Dukelow, are all the people being treated in critical care from Middlesex-London, or is London Health Sciences Centre treating people from outside of the region? If they're not from Middlesex-London, where are they from?
Thank you, Jane, and thank you, Dan, for the opportunity to put the numbers in a geographic perspective anyway. As you're aware, as an acute care teaching hospital, we do serve a large region, and over the past 4 weeks, if you break the numbers down, approximately 1/3 of our COVID admissions have been from London Middlesex, while the other 2/3 have been from outside London. And this is reflected in our current inpatient numbers. You can imagine that the length of stay varies from patient to patient, but to give you that perspective of basically 1/3 from London Middlesex and 2/3 from outside of London Middlesex. Patients that from outside London come to us and are transferred to us for a number of reasons. Some present directly to our emergency departments from neighboring towns, as well as we accept transfers from healthcare partners facing capacity challenges. We also see patients from outside the city who need more specialized levels of care. I can tell you that the majority of these patients are from within Southwestern Ontario. Almost all the patients are from Southwestern Ontario, and many of them are from the areas with the higher rates of COVID due to lower vaccination rates.
Thank you very much, Dr. Dukelow. Let's go to the last question we have in the queue this afternoon, and we're going back to Christy Lee Varley. And it looks like Christy Lee had some technical issues off the top of the briefing, Dr. Summers. She would like to know, are the doses in fridges in London ready to be administered? And I'm guessing these are the doses for the 5 to 11-year-olds, or are we still waiting for them to arrive?
Thanks for that question, Christy Lee. We're still waiting for them to arrive. We anticipate arrival of the vaccine Wednesday or Thursday. Again, not within our control, but that's why the first vaccines will go out on Friday. We want to make sure that we're not canceling appointments, but we want to make sure we've got appointments as soon as possible. So Friday's our go live date, and we eagerly await the arrival of those vaccines. I understand from social media that they arrived in Canada yesterday on a UPS plane. So we know they're in the country, and now it's just a function of distribution. I do reflect rather gratefully on the remarkable fact that this vaccine was approved for the pediatric population on Friday, and we already have it in the country and will likely be into kids as of Friday in our region. That's a pretty amazing turnaround, and so we're certainly grateful for that.
Thank you very much, Dr. Summers. And that does bring us to the end